So let's talk about what to do if your breasts end up different sizes after surgery. And this can happen after any surgery. And frankly, it happens after every surgery. There is no patient with perfect symmetry, but having asymmetric breasts after surgery can lead to a lot of distress. So first, I think, again, it's important to recognize that every single patient out there has asymmetry. There is no woman who has perfect symmetry in her breasts. And we always try to get things as close as possible in the operating room, but for a variety of reasons, it may not always work out. So why does this happen? So although we always strive to get things as close as possible in the operating room, there's a couple different things that can happen with healing that lead to patients feeling asymmetric. So sometimes you can end up with size asymmetry. One of the most common reasons we see this is weight gain and weight loss. So your breasts are a mix of breast tissue and fatty tissue, and that can be different side to side. So even small amounts of weight gain and weight loss can lead to asymmetry. Sometimes it's position of the breast itself. Sometimes women have a breast that sits a little higher on one side. And then another thing that patients often don't like is when their breasts feel one is narrow and one is wide. The footprint of the breast is different from side to side. And like I said, we always strive to get things as close as possible, but some things just don't heal as we wish. So the most important thing is to wait a good 6 months to a year after surgery. A lot of asymmetries that happen after the operation will resolve with time. So allowing swelling to go down, collagen to soften, gravity to affect your breast will often lead to things evening out and nothing needs to be done. Okay, so you've waited that 6 to 12 months. Let's start with size asymmetry. So in general, I don't recommend chasing size asymmetry unless it's more than a half a cup size difference. And it's obviously your body. We can chase it if it's less than that, if it's meaningful to you. But like I said, that's what we consider normal. And I think the risk of the operation and cost of the operation probably isn't worth it for a size asymmetry that's less than half of a cup size. So there's a variety of different things that we can do to make you more asymmetric. We can take out a little bit more volume on the bigger side. We can add some more volume on the smaller side. That can be done with implants or with fat grafting. So it just really depends on what you want as the patient. So when it comes to breast position asymmetry and breast footprint asymmetry, I think, again, you always have to consider, am I within what we consider normal or am I out of that range? And if you're out of that range, there's things that we can do to improve your symmetry. So we can drop one breast a little bit lower, raise one breast a little bit higher, add some more volume to make a narrow breast wider, or reduce a wider breast to make it more narrow. So what we choose really depends on which side you like better, and then we'll alter our plan depending on what you want as your ultimate goal. So like I said, this is a really common complaint after surgery, and in almost all patients it will go away with time because as things settle and you get used to the new position and shape and size of your breasts, things will start to feel normal and won't bother you so much. It's completely normal to be very aware of an area after surgery and nitpick every tiny little detail. But as you get used to everything and it feels normal to you, a lot of that hyper awareness will go away and patients are happy and nothing needs to be done. But things can be done, like I said, if it's just not what you wanted and it's way outside of normal.